the CheckMate 743 is addressing, I would say, an unmet need in the field of this rare disease entity, which is pleural mesothelioma, trying to find the right positioning of immunotherapy in that disease. We have been seeing some promises, meaning that some activity of immunotherapy can be seen in this disease, but still today we didn't get what we call evidence-based data to position immunotherapy in that setting. 743 is the first trial already presented once. Now we have a longer follow-up, 1 additional year of follow-up. Is the first attempt which is successful in establishing evidence-based data for immunotherapy, and this is very interestingly in the frontline setting, in the setting of patients who have not received any previous treatment. As I said before, it was about pleural mesothelioma in patients naive from any treatment and a good performance status of 0 to 1. The patient was stratified according to 2 factors: histology. In mesothelioma, we classified mesothelioma from epithelioid to non-epithelioid, so stratification by histology and by gender. In that trial, more than 600 patients were randomized 1-to-1 to nivolumab and ipilimumab versus the usual platinum-based chemotherapy, which is cisplatin or carboplatin plus pemetrexed. The primary endpoint is OS, which was already presented, but we present an update with a minimal follow-up of 35.5 months. And we have all the usual activity secondary endpoints. And for the first time, we present the exploratory analysis of biomarkers. You know, the grail, the landmark of all immunotherapy trials is still to try to find biomarkers. And that's the first presentation of biomarkers in CheckMate 743. First of all, maybe it's good to think on a patient perspective and on a practical kind of point of view. With this additional follow-up, with this minimum follow-up of close to 3 years, we can show that we maintain the very significant survival benefit for nivo-EP versus chemo with a hazard ratio of 0.73. And now that we can look at the milestone of 3 years, 36 months, we can see that 23% of the patients in the nivo-EP arm are still alive versus 15% in the chemotherapy arm. So that's quite important to show this follow-up data and the maintained benefit of nivo-EP versus chemotherapy. We also know that now almost half of the patients in both arms received subsequent treatment. In the chemo arm, 22% received the immunotherapy later on, and in the immuno arm, 43% received chemo later on, just for the follow-up of these patients, but some of them still need to potentially be treated later on. We have also performed this biomarker analysis, right? Again, it's really the bottleneck of everything we do with immunotherapy. We know that some people derive long-term benefit. Some speak about cure, right, with immunotherapy, but we still completely unable to identify who are these patients in lung cancer, in bladder, in renal, in melanoma, and a fortiori in mesothelioma. So in that trial, we tried to analyze the usual biomarkers. We tried to analyze the series of I would say, immune-related biological parameters, and I'd like to describe 3 of them for you today. The first one is we looked at what we call the long immune prognostic index, the LIPI score, which was shown to be strongly prognostic in non-small cell lung cancer. This is a combination of an assessment of LDH and the neutrophil to lymphocyte ratio from peripheral blood samples. The LIPI score was again prognostic in mesothelioma, but was not predictive, unable to predict who are the patients who benefit from IO more than chemo. We of course looked at TMB. TMB using whole exome sequencing matched with normal samples. We looked at the total number of somatic missense mutation, and even TMB in that setting was not predictive. But last but not least, we look at a very nice, what we call inflammatory signature. Just 4 genes, CD8A, STAT1, LAG3, and PDL1. It's performed based on RNA sequencing on the formalin-fixed samples. And interestingly, in that specific trial, this 4-gene inflammatory signature was predicting the efficacy of nivo and EP, but not at all of chemo. So maybe in terms of moving forward with next trials, it might be interesting to look at the expression of these immune genes with some kind of signature to make it even more efficient. But today, to answer your primary question. Without thinking about exploratory biomarkers, this trial is very important to fix the new standard of care for mesothelioma, pleural mesothelioma, in patients who have disease not amenable for radical treatment. And in this patient's population, nivolumab and ipilimumab is confirmed as being today the standard of care, regardless of any biomarker and regardless of histology.